Hi, I'm Dre, the host and founder of the Draegan Network, an online community where health IT professionals come together to share ideas, discuss experiences, and collaborate with one another on all things related to health IT. I'll drop a link in the description below if you want to hear more. In today's video, I want to talk about storage. We spend a lot of time focused on systems, workflows, and data exchange, but none of that works without the storage behind the scenes. Where data lives and how it's accessed can shape performance, scalability, and even how easily teams collaborate. There are three storage types that you'll run into again and again: local, NAS, and SAN. Each one has a specific role, and understanding the differences can help you work more effectively with your team and plan smarter for system changes. Let's start with local storage. This is the simplest model. Data is stored directly on the device that you're using. So a desktop in a nurse's station, a diagnostic workstation, or a local server sitting in the back room. This kind of storage is fast and doesn't rely on the network. It works well for isolated use cases, like when a radiologist temporarily stores a handful of studies for quick access while reading images. But local storage has its limits. It doesn't scale, it's harder to back up, and the moment you need that data somewhere else, or want it connected to a broader workflow, it becomes a bottleneck. Local storage is fast and simple, but it's isolated. Once the work becomes distributed or part of a clinical system, you need something more connected. That brings us to NAS, or Network Attached Storage. NAS is a dedicated storage device connected to the network. It works at the file level, which means it stores folders and files, and systems interact with it like they would a shared drive. Think of it as a centralized folder that multiple systems can access at the same time, without each application needing to manage its own storage. Let's say you have scanned documents that need to be viewed by multiple departments. Storing them on a NAS means they live in one place, but any authorized system on the network can retrieve them. NAS is relatively easy to set up and scale, and because it handles the file system, it can be a good fit for shared content that doesn't need ultra-high-speed processing. So when you hear NAS, think of shared access to files managed by the storage device itself. Now let's look at SAN, or Storage Area Network. This is where things get more specialized. SAN works at the block level. That means it provides raw storage space, like handing a system a blank drive. The system formats it, manages the file structure, and controls how the data is used. Unlike NAS, which organizes the files for you, SAN gives systems direct control over how data is written and retrieved. It's built for speed, consistency, and high-volume processing, especially in clinical systems where downtime is not an option. If you're supporting a Tier 1 application, chances are it's backed by a SAN. Each of these storage types has a role to play. Local storage is fast, but limited. It's fine for isolated use, but not for sharing or scaling. NAS supports file-level access across systems. It's a practical choice for shared files, like scanned documents or media files that need to be accessed by multiple systems. And SAN delivers block-level storage for high-performance applications. It's built for speed, control, and for systems that need to stay up and running at all times. You don't have to be a storage expert to work in health IT. But understanding how these storage models differ helps you troubleshoot smarter, ask better questions, and collaborate more effectively across teams. If you found this video helpful, give it a like so others can find it too, and don't forget to subscribe so you can be notified when new videos are posted. If you're curious about the Draegan Network community, I've put a link in the description below so you can find out more. Thanks for watching.